And we're ready.
Okay. Good evening, everybody. Welcome to our Rodham Institute's Impact Speaker Series. As you remember, May is Mental Health Awareness Month. And for those of you that didn't catch our summit this past Thursday, please log on to our website so that you can see the excellent panels that we had. I think they were robust. I certainly learned a lot of information. And before we get started and introduce our wonderful panel, just a couple of things wanted to share with you. As we kind of move to version 2.0 or version 3.0 on vaccinations, just want to point out some of the initiatives that are happening in the city. This past Sunday, I had the pleasure of going to Temple of Praise in Ward 8, which is headed by Bishop Staples, and Pastor Webb is one of our beloved partners that we work with all the time. And I just want to tell you about what they're doing, because sometimes in all the negative stories, you never hear about the positive stories. Did you know that since the vaccine became available, they have vaccinated 4,600 people? Do you know that they have weekly, not just vaccinations, but testing? They actually have portable clinics, so they've got 12 different rooms where people can get vaccinated. Did you know that they've provided 1.2 million meals since the pandemic started, not to mention all of their services and support services. So I just want to let you know that when you hear not good things about what's happening, remember that in our community, we have leadership and people who are just doing incredible things. And we just need to elevate and shine the light on these groups because they are tremendous. As we go to these sort of more individualized campaigns, I actually was interviewed by the New York Times and brought the reporter with me to Temple Praise, because the model that they're using of holistically looking at the people that we serve, so that it's about food, it's about housing, it's about mental health and vaccines, because guess what? If people don't feel hopeful, they're not going to get vaccinated. If there's a lot of gun violence and people are, feel like, what does it matter? They're not going to get vaccinated. So that's why leadership is so key. And we have to really make sure that we're supporting initiatives such as this. And just to let you know, they run out of vaccines every time. So again, the story and the narrative needs to change, and we need to follow the examples and the models that work. All right, well, without further ado, I want to welcome people to this very special webinar. Forgive me, I told you I just came from work, so you have to forgive me. This very special webinar on mental health among our special human beings, our special children. We've been working now with the Hospital for Sick Children, which actually serves the disabled people, residents that live in the district, and children and youth. And, this is a blind spot for a lot of people. You think about health disparities or improving health equity, and there can be minorities within minorities. Imagine for a second that you're a parent of a child with special needs, and it's the pandemic. And a third of the healthcare workforce in the home health aides have just dropped out. The family members that normally can come and give you support can't come anymore because they don't want to get, your child sick. You then shift from in-person learning to online learning. Well, that might not be the best way for your child. That is if you have internet and if you have computers. So all of the supports for you personally, of your family and friends, and for your child, okay, and the pandemic keeps going on, and we were in the middle of the Trump pandemic and the racism pandemic. That's a lot to deal with. So we want to just introduce or have them introduce themselves this evening. And I'm just so delighted to have a conversation on this extremely important topic and for us to get further educated. I think I'll start off with my friend, and they're all my friends, Dr. Malena Banks. Can you introduce yourself and tell us what you do?
Absolutely. Thank you for having me. So, I'm Dr. Banks. I am a child, adolescent, and adult psychiatrist. I have a clinic located in Southeast called Lotus, the Center for Behavioral Health and Wellness. And how I came about this clinic, in addition to one of my colleagues who was also a board certified child psychiatrist, is we really understood the need for specialist services east of the river. So we were really much engaged in that particular population, my kids of color, making sure that they get the appropriate services, because again, I really feel like mental health is not a privilege, it is an absolute right. So I've been doing this work for 20 years or so, and we'll get into, that I recently wrote a children's book to be able to address what's going on with COVID and making sure our kids are okay with all that's going on with the multiple pandemics that Dr. Gigi was just referencing.
Can you put the name of your book in the chat?
I
And
certainly can.
Is it available on Amazon?
It's available on Amazon.com.
Well, I mean, as an auntie was a great auntie now to younger kids, and an aunt to a 13-year-old, we are always looking for great and positive and culturally relevant books. So we'd love to promote that. And someday when we can all get together in person, we could even have a book signing. What do you say?
I would love that. Thank you.
Well, we love to promote the great work that's happening.
Absolutely.
Dr. Lui, can you kindly introduce yourself?
Absolutely. It's such an honor to be a part of this panel and to be with you all virtually this evening. I'm Joyce Lui. I'm an assistant research professor at the University of Maryland in the Department of Psychology. I'm a clinical psychologist by training, focusing on children. And currently, I'm part of the Maryland ADHD program that's directed by Dr. Andrea Conis-Toscano. And so what we do in that program is we study early risk factors for how and why children come to have attention and executive function difficulties and ADHD, and how we might be best able to intervene and set children up for success. And so in that vein, we also develop treatments for children and adolescents with these difficulties. And we have a program right now called the TPAC program, where we're partnering with Children's National Hospital in Southeast DC for families with 3 to 8 year olds. And again, figuring out really how to best support families where parents and children are both struggling with some of these attention difficulties.
I'm sorry for mispronouncing your last name. It's Dr. Joyce Lui. Is that correct?
Yes, thank you.
Forgive me. Thank you for that. Dr. Dalton, welcome. Please tell us about yourself.
Good evening. Again, welcome everyone. Thank you so much for having me on this panel. It's a very timely topic. I know those of us in the mental health field have seen an increase in the number of children and adults who've come through. I'm a board certified adult and child psychiatrist, have worked in the public system pretty much ever since I've come out of medical school, worked for the district. I've also worked in emergency settings and consultation settings since I've been doing this, and Dr. Banks said 20 plus years, so I guess that makes me even a little bit further along than she is. So I've been doing this for a while. I'm currently the Chief Psychiatric Medical Officer for HSCSN Health Services for Children with Special Needs. We are a managed Medicaid organization, and we basically are the insurer for children who've been identified early on in their lives, who have a disability and may need special care and management in the managed Medicaid arena. So and my job specifically is to help make sure that the mental health services in that organization are up to par and help with coordination of those individuals. So we're very happy to be here. Like I said, I've known Dr. Banks for a while. It's nice to meet you, Dr. Lui. And again, we're just very happy to partner on this very important topic.
So thank you, Dr. Dalton. So let's start off with you. What have you seen since the COVID pandemic began? What are some of the trends that you're seeing?
Right. I think the biggest is anxiety. It's very interesting that we're doing this discussion today. I was literally walking my dog today, and my neighbor came up to me and said, my child is having a lot of anxiety. And I said, well, how old is and I know his son a little bit. And I said, well, how old is his age specifically? So he's 6 and he's going to school, but he's really anxious now that he's leaving mommy and daddy, while they're still at home. And then he's going to school and he's worried about them at home. And I think that the idea of separation anxiety for children who have been through such an event, children are remarkably resilient, and I tell parents, a lot of their reactions are based on how well you handle the situation. And as long as they know that they're going to be safe and that you're going to be there for them. But still, it's a transition. And this is a child who already had been to preschool, had already experienced what it was like to be away from a family. So I can only imagine what it's been like for children who first entering the school, been doing it either virtually or not been doing it very well. So I think that's one of the things that we've seen is a lot of anxiety. Now with the older children, I noticed that we've seen a lot of trends along the lines of depression. It's been quite remarkable with the idea of loss in these children, not loss of like grief of losing a person, which that has happened too, because we've had individuals who've lost family members, but also the loss of life events, proms, going to sporting events, just doing things with their friends that they would normally do. They are really, I think, struggling actually a little bit more than some of our younger individuals.
Yeah, I mean, I think that the two groups that probably struggle the most are teens and seniors.
Yes.
Seniors, because they're so isolated. Actually, I saw a patient today in clinic, and she's like, I'm all vaccinated up with nowhere to go.
Yep.
She's in her 70s and feeling that isolation. She said, I was fine at the beginning of the pandemic, but now I'm having a harder time.
And the loss of that sense of community events, such as church, if they went to weekly, bingo or whatever, I know bingo is probably not bingo anymore, but whatever it is that people do now, getting out their house, meeting at the park or meeting at the mall, just to do the walks with their social context. Yeah. It's been gone. And I think people are really struggling with that.
Yeah.
Yeah.
And you're right. Please go ahead, Dr.
Yes. No, and I agree with Dr. Dalton. And I think, what he was speaking to, especially in the younger population, is that sort of regression, right? So milestones that kiddos have absolutely made, and now all of a sudden wanting to stay home with mom, sometimes some bedwetting for the smaller individuals, right? So milestones that they had previously made, and now that they have lost. And as Dr. Dalton was saying, is in the older kids, absolutely depression. And then another phenomenon that we're seeing now is this FOMO. So we talked about FOMO, right? This fear of missing out previously, with, individuals doing things that they can't do. But as each school, as each district, as each state opens up differently, then they may be opening up, right? So kids are posting things that maybe they're not able to do. Things around family members feeling comfortable around people being in their spaces, vaccinated, non-vaccinated. So it looks very different, street to street, state to state. It can look very different, school to school. And so kids are really sort of having that angst. And also the households.
Yeah.
That's right.
So what is FOMO?
I'm sorry. So this is the fear of missing out. Right. So this is which comes from, sometimes a place of sort of low self-esteem, can come from depression, can come from overall anxiety. And then you add to this new phenomenon of sort of having your highlight reel that kiddos are looking at on a regular basis on social media, different platforms. And so they feel like their life is not matching up to what's going on online, which we saw quite a bit of even before COVID started. But we're seeing an uptick in it just because, again, with the reopening and everybody doing things differently, we're seeing more of that angst because their friends are doing things, even having a sleepover with a friend, right? Is something that they're not able to do. And then sort of that's causing an increase in angst as well in our kiddos.
It's interesting because medical school graduation is happening this next week. And although certainly medical students can understand intellectually, it's still a big deal to miss out on these big milestones. It's like you've worked hard, whether you're graduating from elementary school or whatever school that you're doing, or birthday parties. And I think that there's a lot of loss there. Dr. Lui, tell me, how does that impact, what we're talking about? What have you seen in the work that you're doing in terms of children who have ADHD and some of these other learning issues?
Yeah, absolutely. I think, echoing what Dr. Banks and Dr. Dalton was saying, we certainly see an increase in anxiety and angst and depression. But I think, in our work, we're also seeing the impact of COVID on families and on parent stress, with the transition to online learning, to hybrid learning models. There is suddenly this need for youth to learn to establish their own routines, to establish structures that typically would have been in place in in-person instructions, but now all of that is gone. And that can be especially challenging for young people with ADHD or young people with attention and planning and organization difficulties. And then if we think about on top of that, that's really stressful for parents to be able to provide support while they also need to balance their own work, other things that are happening in their lives while supporting their kids' online learning. And this is, this can be even more taxing when parents are struggling with their own mental health concerns, whether it be ADHD, depression, other mental health concerns. And I think that really highlights the need, I think a really great need for us to start to have conversations about, integrative treatments, really thinking about how parents' mental health also impacts, child development and child treatment as well. And so we're certainly seeing that in our work.
Well, I think, one of the things about this society is that we tend to look at the individual instead of whole family, whole community care, right? So, for any of you, how, one of the, I guess, the silver linings when you deal with a pandemic is that it uncovers or unmasks or pulls the veil of deep problems that you're all familiar with, but perhaps society was not familiar with. So sort of moving forward, how can these lessons learned impact what we do moving forward in terms of, I'm talking about either policy or, more sort of at the 30,000 foot view? Anybody?
Oh, okay. Well, I guess I think as far as policy is concerned, we have really seen, and I saw this when I lived in New Orleans, when I worked in New Orleans and during the time of Katrina, another type of disaster. And then we see this type of disasters that we are woefully underprepared for any type of disaster or catastrophe in this country. And I think specifically when we wanted to attack these issues, excuse me, I have allergies. This spring allergy thing is getting me really bad here.
Okay.
It really should have been a multifaceted approach. It is not just staying at home. It's not just health. It's mental health. It's school. It's infrastructure. I come from rural North Carolina. I don't know how those kids are learning there. Some of them don't have internet access. I wonder about kids who are spending so much time in front of a video camera. I know I get exhausted with it and headaches and tired. How is all of this going to affect us? But I think the other matter is really how do we establish a community that's, we have a community, so to speak, with your family and with your church. But it's particularly in urban areas, we are still quite isolated. You can be on the same block and not know your neighbor 2 doors down. But that has to change in this type of situation because everybody becomes interdependent as well as codependent. Is what I say, because, you may need to partner up with someone if you have to go to work one day and you need childcare. Who can you trust? And then families are starting to have to live together more. How are the resources being stretched in at home where you have, I don't know how parents are doing it, where each one of them has to be on a call, plus 3 different kids with 3 different schedules. That is highly stressful. And I think that when we look at, even as Dr. Banks and Dr. Lui were saying, the reintegration with that, how is that going to work now? And then we've added pets in. Everybody's gone and gotten the pets, me included. Now what do we do with that? How do we start establishing a schedule in the middle of a chaos? And then that schedule itself is going to be chaotic and ever change.
Yeah. Well, speaking of schedules, please talk to us about the importance of schedules. I was telling the residents in clinic today, sometimes I don't know what day it is because our schedules are so topsy-turvy. You come to in-person clinic, then you go to Zoom, then, it's like, and then the weather changing actually does not help.
Yes, exactly.
Am I right? So, from the psychological or mental health piece, I know that children are much more sensitive to schedule changes. But Dr. Lui, you brought up the point of, thinking about the parents as well. So we know that a lot of things are in disarray and probably will continue to be with the new shift to a new schedule. But what advice, Dr. Banks, would you give to families who are trying to get their kids back in some sort of structure?
Absolutely. So I think that is a good point. And I think one of the things that I definitely try to stress to parents as much as possible, and I know that there's quite a bit going on. The pandemic happened, right? So it put a stop in a lot of the things that we were doing. But just like if, unfortunately, if a child got sick or if a child ended up having cancer, we always say, don't stop doing the things that we were doing before. So that means routine, right? But that also means managing our expectation. I think that is so. Okay, so they may not go to bed at 9 o'clock, but 9:05 is going to be okay. 9:10 is going to be okay, right? So still having structure, but having a little bit of flexibility within that structure, right? But we still need to stay on task. We need to still get up in the morning, because a lot of my kids, what they're doing, especially the older population, which if class online starts at 8 o'clock, 7:55, they are slinking out of bed, right? to sit in front of that computer. Absolutely not, right? We still need to get up at least, we may not get up an hour and a half early, but we still need to get up maybe an hour, 45 minutes early. We need to do our stretches. We need to have breakfast, because breakfast is important, right? I know people say it all the time and doctors tell us that, but it is important because we need to be able to stimulate, growth for the brain to be able to have, food, right? Literally food to be able to feed on, for us to be alert in the morning. The stretching is super important, because Dr. Lui will co-sign that, because again, we need to stimulate that frontal lobe, right? For us to be able to attend, put the brakes on things, for us to be able to be focused. But in 5 minutes, that doesn't feel good for a transition. And they wonder why, oh, well, I'm not doing well that day. Well, yeah, we didn't give our stuff time to transition, because just walking to school is a transition that was in place that we didn't really account for, right? But now we have to account for that time. We have to give ourselves that time and that space. And that goes for parents as well, right? To be able to keep a routine as much as possible for everybody in the house. That way we can have, better days, and then managing our expectations around that scheduling. You might need just a little bit more flexibility.
And Dr. Lui, I mean, for children or young people, or even adults for that matter, who have ADHD or other issues, what are sort of the key things, and do they differ from what Dr. Banks has just brought up? I mean, are there other additional sort of suggestions that you would recommend?
These are great questions. I agree with Dr. Banks. I think keeping a routine and having structure is paramount. And I think what's difficult with individuals with ADHD is how to build the routine. And so because of the executive function difficulties that they experience, it's hard to get started. It's hard to know how to even build a routine. And so, the great thing is there's lots of tools out there. We ourselves are developing sort of these short 1 to 2 minute videos to be able to effectively in a way that's engaging to teach people how do you set up a calendar system, how do you set up to-do lists or prioritize to-do lists, how do you break a large project down into smaller chunks. And so there's lots of tools and information out there that can help individuals with ADHD take that step to build those routines. But I absolutely agree with Dr. Banks. The routine and the structure is key.
I think and one other thing is learning to prioritize. I think one thing that parents try to do that we saw, which I think is one maybe blessing out of all this, is they try to do everything. Child have to be in this program, they have to get this, we have to do this. Now we can see that we can simplify our life, have a good life, keep a schedule, as everyone is saying, and then gradually integrate back in. Because again, it's going to seem like Dr. Lui said, a big task. Your child doesn't have to do everything. They just need to do a few things. You don't have to do everything. I think people need to step back a little bit, keep it simple, and as they step back out, do what's comfortable. You may not feel comfortable going in a restaurant, but you may feel comfortable having a picnic in a park. Do things like, and that's another important thing in that schedule. This is Dr. Banks and Dr. Lui was saying, building time to transition to school, also giving yourself a break, getting out of the house and taking just a short walk will wake your mind up in so many ways that you would not believe. It doesn't have to be vigorous exercise. It's literally just taking a time out.
And tell us, Dr. Dalton, in terms of children or youth with special needs, what are some of the additional challenges for them or their families that you're seeing?
I think one of the biggest things is when we talked about community, their providers and caregivers are big parts of their community that they may not have had access to. So I think the expansion of virtual sessions has been a godsend for some children. because they're able to see their pediatrician, they're able to see their case managers, some of their therapists that during this time they may not have been able to do. And I think that's one of the, but it's also been a struggle because it still doesn't take the place for that one-to-one in person, but it has served to bridge the gap a little bit. And I think that's one of the things that I think now that we've seen the value of telehealth in so many different ways, not just psychiatry, but in all the other different disciplines as well.
But what about, I mean, are there people that you serve that don't have the internet or don't know how to navigate?
Absolutely. And we've actually had teams, some teams have actually still tried to go out, practice social distancing, practice, wearing the right protective equipment. Because we've seen it, we've learned a lot from this pandemic. In the beginning, we know, it was DEFCON 20 or 500, as I say. But then as we've gone along, we've learned, if you mask, if you practice hand washing, if you do the social distancing, you can actually do some of the things that you weren't able to do before. I've actually seen clients still in my office. They sat across the room from me with their mask, and I've had my mask as well. And these are teenagers. And so I think if it is absolutely necessary, and especially for some of our kids who have some of the most severe things, such as autism and those things, who really would have a hard time sitting in front of a camera, it's been very helpful to be able to start pretty early on. We started this adventure in February or March of last year.
Too long ago, yes.
Yeah, by the summer, I think we worked out a system for some of our highest level kids, but some of them were still able to be seen.
We're assuming that telehealth or teleeducation is negative, but I've also heard from parents who said, actually one of the people on our panel this past Thursday said actually that one of her children who had issues around learning is actually doing a lot better, and for the first time had straight A's. Is there something that predicts who would do better in that setting versus, as we're thinking about these hybrid systems for education or even healthcare, that can predict for each of you? We'll start with you, Dr. Banks.
Yes, I'm so glad you mentioned that, because I do think a lot of times we do spend a lot of time talking about the kiddos that are struggling, which we need to, but there are a subset of kiddos that are absolutely thriving, and they're thriving for lots of different reasons, right? So looking at sort of what their pre-morbid functioning was prior to COVID. So for some, actually, school wasn't necessarily a safe environment, right? For some, home is, because in school there was bullying going on, there's cyberbullying, there's all sorts of things that are going on in school that sort of got in the way of this student being able to learn. And then also taking into consideration, like you were just talking about, some other pandemics that are going on, right? So for some, right, so walking to school is dangerous, right? Just sort of the neighborhood itself. So now I don't have to have that walk. I have all my things that I need right here in this house. I don't have to worry about, being bullied when I get to school. I'm not, some of my kiddos who have social anxiety, right? So being around others was very stressful. And now all of those things that were existing in that walk to school in school are no longer occurring. And so now they're able to better, to thrive. And also be clear, some of our adolescents, they've been practicing their whole life for this very moment, right? So being on social media, being in front of a camera, being on 24/7, some kiddos have actually, again, done better. Not all, but there's definitely a subset, for whatever reason, based on, again, what their pre-morbid function and sort of what was sort of going on, the challenges for them in school that they're no longer having to face now being at home in front of the computer.
So Dr. Lui, are you, in terms of your research, looking at the effects of teleeducation and telehealth on the children and youth that you're kind of following? Can you tell us more about that?
Yeah, great question. That's not, we haven't looked into that directly, but certainly I think from the literature, lots of other folks are addressing this really important question. I think one point that Dr. Dalton mentioned early on is, I think there's certainly kids who are socially anxious, who are doing better in this virtual environment. But then I think it raises the question about, what else are they missing if they stay in a virtual environment, and really thinking about what reentry into in-person instruction will look like. There's also, I think, research showing that the pandemic has negatively impact lots of kids, but for kids with ADHD in particular, they're struggling even more with suffering even more in terms of their academics, precisely because of some of the difficulties that I mentioned in terms of how do you set your own schedule, how do you make sure you do your homework, sign into class on time. And so I think we're definitely seeing a much more negative impact for children with ADHD.
So Dr. Dalton, before we go to Dr. Banks, because I want to hear her reading from her book. I'm so excited. But Dr. Dalton, I've read, and correct me if I'm wrong, that children with disabilities have actually dropped as many as 2 grade levels in terms of their education. Can you talk about that?
Well, I think it's definitely an issue. And I think part of it is the structure of the shortage of special education providers and people who understand what it means to provide education to a child that has special needs, whether that child has a physical disability or a mental health disability. And likely, most of those kids have overlapping disabilities in themselves. So I think that's one. And I was talking with a colleague of mine probably a month or 2 ago who specializes in consultation to schools. And he says, this is a great opportunity to look, and a unique opportunity for us to look at different learning styles for children, because again, some have thrived and then some haven't. And then what about that child who did have a little bit more of a problem in the actual in-person area, but then started to thrive on camera? Is there a way to create pods now, educational pods, where you do a smaller group and a mixture of those children, allow them to thrive? What about, as Dr. Lui says, the ADHD who gets highly distracted, maybe in a bigger group, but maybe in a smaller group now will do better, or maybe some type of hybrid of all these together. So I think when we talk about the delivery of healthcare and then its intersection with mental health and physical health, or just health overall, because there's a lot of social determinants of health too, like we were talking about, poverty, feeling safe in your own communities, racism, sexism, every kind of ism that we have. And how do we look at that now? Because the other interesting thing is not just COVID. We've had so many other stressors with COVID, school, things on the TV, political stressors. We're in DC, we can't escape it if we wanted to.
George Floyd and the serial killings of Black people, and now Asian Americans being attacked, right. Some horrible footage
and all
there.
These things, now that we're kind of tempered down a little bit, and they're starting to explode again, and explode, I think, in even bigger ways. And so I think all of these things can be examined in a different way and need to be examined. And then the question is not letting those kids get lost.
Exactly.
A lot of times those kids do get lost, even in the midst of thinking about children. Kids who have special needs sometimes still get lost, because we know the first things to be lost in anything is mental health and education, and then probably the arts, which I'm a big arts person too.
Well, I'll turn things over to Dr. Banks. I'll just say one thing about the arts. Arts are going to be the way that we heal as a society. I really, really believe that. And to me, if anything has come out of this pandemic, is the value and importance of teachers, as well as artists, musicians, all of that. I mean, I think that those are key. And I was talking to a colleague today, and actually one of my patients who's got a 90-year-old mother who has dementia. And I said, and he was saying, how it's this horrible system to get, care for seniors. I said, as a society, we will be judged by how we take care of children, how we take care of seniors, and how we take care of families. And right now we're not doing too well. But let's transition to something positive. Dr. Banks, would you like to do a reading for us? I'm so excited to hear. You're on mute.
So based on sort of all the things that we were talking about, I am one that likes to be able to point my families to a resource, right? So whatever sort of the kiddo was struggling with, well, here's a resource I can give to the family. Well, COVID happened, and there wasn't any particular resources for my families to be able to sort of point them to, because kiddos were struggling, right? And I'm always thinking about, have we checked on the kids? Are they okay? So where there isn't, you must create. Right. So between myself and my colleague and friend, who is a child psychologist, based on what we were seeing, we developed this book, and it's called I Miss My Friend. And everything in this book is very intentional, based on representation, based on sort of having a child psychiatrist live in the neighborhood. So it was all very intentional. So I just want to read a little bit in interest of time. I won't read the whole thing, but we'll definitely read a little bit. So it's called I Miss My Friend. Boring, Malika whined when she found Carter hiding in the exact same spot for the millionth time. Can we please play something else? Okay, teased Carter, but first you have to find Bradley. I am so over this, said Malika. She slumped down next to her mom in a huff. Mom put the phone down and asked, what's the matter, Malika? Before Malika could answer, Dr. B walked by and waved. Dr. B is a psychiatrist in the community center around the corner and walks by almost every day on her walk. Mom waved back. How are you doing today, Dr. B? Malika half-waved and mumbled, hey, Dr. B. After all, she didn't want to appear rude. I'm good. I'm just trying to stay positive during this pandemic, but my patients really need me, and I'm happy to help them. We have to help each other make it through this tough time. Mom put her mask on and walked closer to Dr. B. Dr. B, she made sure she was a safe distance. I hear you. We're still just trying to make it. We're doing our very best, but it's hard. Dr. B did notice that Malika was moping. It looks like she's had enough of this whole virus thing. She doesn't look like her happy, bubbly self. Yeah, Mom agreed. She's definitely not herself these days. I've tried talking to her, but she doesn't really say much. She spends a lot of time in her room. I practically have to beg her to come outside. Dr. B was concerned and promised she would follow up with Mom when she was finished with patients that day. And just before dinner, Dr. B called Mom in for a video conference. And she asked if Malika was available to talk. She says, do you think she might talk to me? Asked Dr. B. It's worth a shot, asked Mom. Malika reluctantly agreed. Hi, Malika. You don't seem like yourself like before. I wonder if I could help. Do you want to talk about how you're feeling? I don't know. I guess. I mean, I'm okay. I feel fine. Mika was really having a hard time finding her words. It's just that I'm being stuck at home all the time and it's so boring. I have to be able to have activities all the time with my brothers and all they want to do is play hide and seek. Dr. B reminded her that she had a friend named Amina. Dr. B said that Carter and Bradley were much younger and that they were boys and they just wanted to play the same games. She wanted to play with her best friend, Amina. She just said to Dr. B, I miss my friends. Aha, I see, said Dr. B. Now that makes sense. Friends are very important. We all need that kind of social connection. We can't be with our friends and it's really hard. I bet you really miss your best friend, Amina. Malika sat up in her chair because Dr. B understood what she felt. She said, yeah, we can't play together and it really stinks. Dr. B said, I know. Sometimes you could be worried and frustrated, but what I do is I talk with my friends and family, I write in a journal, and sometimes I just have a good cry. What about when you feel lonely and you can't see your friends? What can you do? Wondered. She said, every Friday, Dr. B and I and Dr. J, we go on a walk. We always schedule safe activities together. She said, Malika said, oh, Amina and I used to make up dances. I bet I could do that with her on video chat. Now you're thinking creatively, said Dr. B. Malika's eyes lit up. That sounds way more fun than playing hide and seek with my brothers again and again and again. Dr. B, you always know what to say. I didn't have to say much, Malika. You figured it out all by yourself. Just remember, we're all in this together and we have to help each other, express our feelings and get help. Malika said goodbye and ended the chat. She did feel better after sharing her feelings, and she just couldn't wait to make up a dance with Amina. The video chat ended with Dr. B, and that didn't change the fact that the coronavirus was still there, but Malika was stuck at home for who knows how long, and that she misses her friend. But one thing did change for now, that Malika's smile was back.
Wow. Thank you. Thank you, Dr. Banks. That was lovely. And I see that Dr. Carol Lang, from the School of Nursing, who is a friend and lovely human being, said that she said, as an adult, I love this message. Thank you. Hope this is on Kindle.
Yes, it is on Kindle. and what is in the back, which I won't read, but it is a tip sheet for parents. And what we have parents have said was they didn't know how to start the conversation around sort of what was going on, right? And the other feedback we got too was, kids saying, oh my goodness, it's happening now. Like they see the masks, right? And then also what's important is what families need to understand is that kids need to know that we're struggling too, right?
Yes,
So we
yes.
can't always try to hold it together, and then because that doesn't allow kids to sort of model sort of behavior like, okay, so I'm not feeling well right now and it's okay, right? So that's what kids commented, like, oh my goodness, Dr. B, you feel the same way that I feel? Yes, we're going through the same thing. So that was some of the feedback that we had gotten, other than also sort of, again, representation. The images were very, on purpose. And also having a community psychiatrist in the community, right? So decreasing the stigma. So mom had sort of no problem sort of reaching out to Dr. B. So again, everything was intentional based on sort of what we see, in our community.
And I know it's available on Amazon, and you said Kindle, so thank you. I mean, I think that for those of us who are adults, I mean, these things make sense.
I miss my friend.
Yes. Oh my God. I mean, actually, you mentioned that it's good for kids to see that adults are vulnerable. I was in resident clinic today and I was complaining. And then the resident said, you feel that way too? I said, yeah, I do. So I think it is about vulnerability as well. And that, Dr. Dalton, you mentioned that people were really running around so much beforehand. And I actually saw a parent who has a set of twins and another child, 3 kids in all. I said, how are you doing with the pandemic? She goes, I feel so much better. I'm not having to run around. I'm able to spend time with a family. And I said, you know what? That's how we grew up. We weren't in a million, activities. So I would imagine that that's true for anybody, particularly, people with special needs. But can you talk about that?
That's called parental FOMO. Fear of missing out, that they're not being the best parent that they could be or whatever, because they see someone else doing something. And it really gets to, I'm amazed when I hear people before they have children having to put their child on, waiting lists to get in schools or different programs, and they're already stressed. I said, you've taken the joy away of becoming a parent for doing all this stress. And one of the things I was wondering from Dr. Lui, I know we were talking about ADHD, but I'm wondering, are parents coming in thinking their child has ADHD, but it's really mass depression and anxiety? I've seen that in some parents too, oh, my child has ADHD. I said, no, it's not ADHD. I said, I think it's something else. And I just think that that's one of the things that we have to be careful too, because I think our parents want to label our children. And sometimes it's just, that's a natural response to things.
Can you speak to that, Dr. Lui? I think that's such an important point.
I agree. I think, I mean, you're right, Dr. Dalton. The symptoms overlap and they look so similar. And so I think it's the job as a psychologist is to really be able to tease apart and contextualize what's happening in the child and the parent to really understand what is the root cause, whether it be depression or ADHD or anxiety. And then sometimes they do overlap, right? We know that they are comorbid conditions in a lot of children, but I think that teasing apart what is the underlying condition is so important, because that points to different treatment strategies for sure.
And to your point, Dr. Dalton, about the social determinants of health, some kids who are in Title I schools were getting their breakfasts and lunch at schools, and the number one social determinant of mental health is food. School also can be a refuge, actually, for some of the things that happen at home. We know that things like domestic violence, child and family abuse, and even senior abuse has really gone up. But one of
our children with special needs are at even more risk of having, of being abused at home, just intentionally and unintentionally, because sometimes they are a lot of work, and parents don't have the respite that they used to have. They don't have an ability to reach out and say, hey, I need a break today. Can someone, watch my child? So these are very important other things that, again, as we take a higher level look at the end of this, what was missing in our system. And those things should have been in place every day anyway for these families. And those are things that we've seen and we've talked about over and over as providers. My God, I wish, sometimes you say to yourself, I wish I could take this child for just an hour or two so this mom and dad can have some time just to go have dinner together for themselves. Or, sometimes the child comes into the office and says, oh, I'm so glad to be here. I've literally had a child say, this is the only place where I can think. And this is a young kid. This is a young child who said this to me, like 8 or 9, because things are so chaotic. So we're all struggling. And I say that to parents and everyone else. If I could measure everyone's cortisol levels, they would be through the roof, right now. But we're all struggling through. And I think that's, as you said, that's the message. And that's a great message at Dr. Banks's book. It's so funny she started with the word boring. If I could tell her how many times when I was home with my nieces, I heard the word, this is boring. And I was like, oh my God, what am I going to do? So, and I'm a child psychiatrist and I'm trying to figure it out,
Yeah, of course. Dr. Lang also made the comment about the fact that school nurses have really been underutilized. I think, as we think about a new normal, really looking at other systems that have been more effective. I don't know whether this in New Zealand or in Australia, but I know that there they instituted in the schools 3 times a day recess. And guess what? All the behavioral issues went down. Yep. In Chicago and San Francisco, they have an approach of the entire school, including the teachers, everybody, the kids, learning about meditation, and they do that. All the behavioral issues went down. Because when I'm thinking about my own childhood growing up in Michigan, I don't remember there being this many sort of behavioral issues. I mean, not that they didn't exist, but it just seems that the pace of life, the fact that you could just go and play out in the street and come home, by a particular time. Thank God there wasn't social media or cell phones. But that's really, I mean, it's making us unhealthy. I mean, is that exaggeration? Am I a dinosaur, or what sort of?
I don't want to hog the conversation. I don't think so. I think, again, the sense of community was different because you didn't have a screen you could be in front of 24/7. By necessity, my parents were like, go outside. We weren't in the house. And so and there were more outside activities. So you were literally bumping into people. Now, the family TV hour is pretty much gone. Used to be families sat down to dinner and then they may have watched a TV show and talked about it. But now you don't have to do that. You can binge watch, but because you're binge watching, you're sitting again in front of a screen for hours at a time and, ignoring different things. So I think one of the things that we've seen is that we're having to navigate, and everybody wanted that. Everybody was like, oh, if I could just stay at home and work from home, it would be wonderful. Not so much, or whatever. So there is value in getting out of your house, as Dr. Banks say, establishing a schedule and feeling like you're going to something that's yours and you're being productive about it, and then coming back home and bringing that back home as well, for adults as well as children. And again, children are a direct reflection of how parents are handling a situation.
Yes, they are. Dr. Lui, I want to shift and talk about your research, and why is it important that we study this? I mean, why is it relevant? I think sometimes people think, oh, research that's so far disconnected from these everyday issues. So tell us a little bit more about the work that you do and why it's important.
Absolutely. I certainly understand that there's this gap. And I think certainly as a field, we can do better in terms of disseminating and sharing our scientific findings in a way that's engaging, because I think it could be really helpful. In our work, we focus a lot on how parents play such a critical role in children's development and how well they do in outcomes, particularly when we're talking about younger children. Parents are really the mediator of improvements because children are so young, right? We really rely on the parents to help build scaffolding for children. And so considering parent mental health in addition to child mental health matters so much when parents are struggling with stress, with depression, with anxiety. That makes it really, really hard to provide the best support for children. And we're certainly learning in our work that it's difficult to bring up the topic of parent mental health. There's a lot of stigma around it, and so we're learning a lot from the parents that we're working with in terms of how do you best bring this up in a way that feels supportive, in a way that's non-threatening, in a way that's non-blaming, because that certainly is never our intention. But I think we have to be really intentional and thoughtful about these conversations, and doing research and understanding how what are some of these strategies, how do we talk with parents, and then what are treatments that work, I think can be really valuable.
One of the things, again, from the mental health summit that we just had, was a parent who is also a public health practitioner. And she was saying, I get blamed so much if my child acts up or whatever is seen as a behavioral issue. I never hear words that are kind or gentle or non-judgmental, from teachers, not never, but rarely. And I know that we in the healthcare system can also be highly judgmental, and parents can feel very blamed. And so whether it's teachers or whatever the system that we exist in, I think we could do a better job.
I think it's incumbent upon us to do that too. I literally said to a friend of mine who said, "Oh my God, I have to be the psyche ER nurse on tonight. Oh my God, it's gonna be crazy, whatever." And I looked at him, I literally said, "I live for the day when my patients come in and receive the same empathy as a cancer patient who comes through the door."
Hey.
And I didn't say anything else, and he literally stopped. And I think it's incumbent upon us, as those of us who work in the field, to remind our colleagues. Because our colleagues, some of them took their vacation doing their mental health rotation or their psychiatry rotation or whatever. Say, look, this is just as important, because interestingly enough, they all end up coming back to us asking us for consultation at some point or whatever. Yep. So I think it's highly important to decrease that stigma that we advocate for our patients. So.
Yeah, I want to read something that just came up on the chat. It says, "I'm stressed out and my son with special needs does not even live with me now. During the pandemic, we were fighting all the time. I feel exhausted. I'm a single parent, and even though this child lives at Sasha Bruce Youth Works Shelter, he is doing well, but I'm not. Every day is a struggle." Can anybody take this statement, and what would you advise for the parents?
So, I can start. So I think, first of all, thank you for sharing, because again, I'm glad you feel, safe in this space to be able to ask these questions. So I'm glad that, you all did choose to sort of, by force or by choice, right, to have this separation time. So that way, your child can be able to get the services they need. But then now, right, that you're having the child at a different location, now is a time to sort of focus on you and focus on the things that you need to do for your own mental wellness. Right. So be it the things that we've talked about already, which is sort of going for a walk, seeking out, counseling. Right. So and I know we talk about this and everybody on this panel may get it, but I want to make sure I say it out there, is that we need to normalize getting a mental health checkup like people go and get a physical every year. Right. So we need to go and get, maybe talking with a counselor, making sure we're getting enough sleep, making sure we are eating properly, making sure we are exercising, because that is the 80% of what we need to do to be able to change our mood. So I would say definitely absolutely start with that. And again, asking for help. It is absolutely, imperative that, if there's, somebody that maybe you feel safe to be able to talk with, asking your primary care for a referral. There are therapists out there. So absolutely making sure that you're asking for help and maintain a routine, get back into a routine, because this is important, because once I'm not sure the exact situation, but if the child comes back into the home, you need to maintain those times where you are taking time out for you to do things for you, because at the end of the day, if you are not well, then you are not able to care for anyone else around you. And I think the best way to think about that is when you sort of get on a plane and they tell you you put your mask on first before you put your mask on anybody else. It's because if you pass out, then now you have two people passed out. Put your mask on first. That means get all your mental wellness, take your walks, make sure you get your sleep, get your nourishment for your bodies before you're able to assist anybody else. So right now is the time to do that while you are separated. So that way you can then, when they come back into your presence, be able to maintain that and feel recharged to be able to do the things that need to be done.
And thank you for giving that permission, because I think as parents, there's so much guilt, right? So many guilt trips that they go on. In the next sort of few minutes as we end, I want to bring up a topic because resources are really important. I know of somebody whose child was in very severe emotional, stress, could not get an appointment to get seen and by a mental health clinician. Where are some of the resources that not only we can post here, but we can post on our website? I know that we have a mental health resource on the Rodham Institute site, but any advice that you have and where we can go?
Sure. If your child is enrolled with HSCSN, of course, you can talk with every child has a case manager at HSCSN. And if they have concerns, you can talk with them. If they are not getting mental health treatment, or if you feel like the treatment that they're getting is not appropriate, or you think it needs to be expanded, we've created some new programs where we actually have an intensive in-home service now where we actually take mental health. It's different from some of the other services for kids who don't fit into CBI or some of the other programs where folks can actually go into the home. Additionally, if you as a parent feel like you need help, still talk to that case manager, because again, as Dr. Banks said, and Dr. Lui, I know will say this too, just as cancer attacks a family, mental health attacks the family. So that's why, we're taught as child psychiatrists, it's not just the child, it's systems, it's everything, it's everybody that's involved. And we want that because a healthy family is critical. And then if you know that there's also peers now, folks who are going through the same thing that you're going through. So you don't have to feel so isolated. That we, in the DC Department of Behavioral Health, there's a peer support for families, for teens, and for individuals. And those peers have helped navigate the system and can help you if you feel, and they've been through it. Those are folks who are not doctors. Well, some of them may be doctors who've gone through it themselves, but they're individuals who have suffered with mental illness and have had to navigate the system. Because I can tell you, having being someone who's had a family member that's been ill recently, I'm in the system, and I've still had a hard time navigating. So it is very difficult. But know that we are here to help, and I know the DC Department of Behavioral Health. If you call and talk to someone there, they can get you some help, and that's 1-877 we help. And if Dr. Banks, in her book, there's resources there. And then the National Alliance for Mentally Ill, there's all these different places. And I'm sure if they call Georgetown, you may not be able to get at that specific site, but there are people there to help you.
And I will, and I'm sorry, and I'll go ahead and also leave my information into the chat as well. Like I said, I do have a clinic in Southeast, and even if not everybody needs my level of care, but we really do a good job of making sure that we give a resource, for everybody that calls. And I just want to talk about another resource for the families. Dr. Dalton did bring it up. There are providers that come into the home. So if you're not able to send your kid to another location or 4 camps or whatever, because I saw somebody in the comments say that, right? There are individuals that will come and work with your child in the home. And then also, again, we have to be creative during this time. Once people have sort of get vaccinated, or if there's people that you have sort of potted with sort of during the pandemic that are in your safe space, it might be shifting off. So maybe a parent takes the 2 children while the other parent is able to sort of go run an errand or go do something. Now, mind you might not get hours at a time, but if you can sort of implement maybe 30 minutes a day, 30 minutes a week, right? And also explaining to your kids, mommy needs a timeout, daddy needs a timeout. So it might be, hey, we create bathroom time, like 30 minutes is mom time, dad time, nobody disturbed. Get your child involved, right? Have them make a do not disturb sign. Have them, bring things into the bathroom that maybe mommy likes or whatever. Understanding, set a timer from this time to this time. This is mommy's time. Mommy is not to be disturbed. So we have to be a little bit more creative if, again, we don't have the resources to be able to send a kid out, and maybe we can't find somebody to come into the home. Explain to your kid, had a family meeting, like, listen, everybody needs a timeout, and this is what mommy and daddy's timeout looks like, and we shall not be disturbed, and implementing that regularly and make it part of the family discussion.
So as we close out, because I think that we need to have like 2 more sessions of this. This was so helpful, and I certainly learned a lot. There were some comments about having your book available in the schools, which I think is a great idea. And also summer camp. Somebody said that they couldn't afford to send their kid to camp. Actually, we just got a notification, I think for 3rd and 4th graders, there are some scholarships for summer camp. There's actually a lot more available than one would think. So check with sort of local groups. But what's clear to me as we close is that, we talk about diversity, and sometimes people think that it's only about ethnic diversity or gender diversity, but really diversity also includes different disciplines. And look how rich the discussion is when we talk about teachers and nurses and families and individuals and researchers and clinicians and educators. How rich is that discussion? We need to, as we're moving forward, I believe, to look at a better system that serves all kids, all adults, that we need to have these kinds of discussions so that we can implement these things in the schools, so that teachers don't also feel like they're the ones that are dealing with this alone, because we really do have to support everybody. So with that, I'd like to thank each and every one of you. Dr. Dalton, thank you for your time. Dr. Lui, thank you so much for joining us. And Dr. Banks, thank you. I think if you give us a special discount, I think that Rodham would like to buy some in bulk and maybe give them to some of the schools and other community centers so that they can then buy them for their kids. And, there is the little libraries of DC that I think we can really support. And I think it's so important.
Yeah,
thank you so much. I hope that you have a great evening, and you've energized me and inspired me. Thanks so much. Take care. Bye-bye.